Good afternoon. My name is Neil Radia, and I'm the chair for the National Association of Care Catering, who are this week leading National Meals on Wheels Week. We warmly welcome you to today's webinar, Meals on Wheels, Raising Awareness of the Service and its Benefits. Thank you for everyone for joining us today. I'd like to start by telling you a little bit more about us, the NACC and Meals on Wheels Week. The National Association of Care Catering are a not-for-profit membership organisation representing caterers working within the care sector, whether that is within the community through services like Meals on Wheels and awareness about the importance of meals delivered in the community, whether that's via the Community Meals on Wheels service, day centres or lunch clubs for older and vulnerable people. As part of the week, we highlight the social, economical, psychological, and preventative benefits of the Community Meals on Wheels service, encouraging public support for local services, and to address and increase awareness that the service is more than just a meal. Today's webinar will look at the benefits of Meals on Wheels, particularly the ones beyond nutrition. We'll highlight why there is a need to raise awareness of Meals on Wheels services from the perspectives of researchers from the USA, a service provider, Bristol City Council and Bristol Community Meals Service, and researchers from the School of Policy Studies at the University of Bristol. We will close today's webinar with the launch of two new infographics co-produced between the researchers at the University and people with experience of Meals on Wheels service in Bristol. But before we begin today's webinar, just a little bit of housekeeping from Mike. The chat function which is at the bottom of your screen, please do use that chat function just to say hello and get involved with the ongoing messaging within that. You can direct chat with just the panelists on that mechanism or with the panelists and the attendees. If you have any questions for any of our speakers, we will direct them to the right person. And apologies from us in advance that if you don't get your question answered, then we will forward them to the relevant panelists after the seminar.
So I would like to make a head start and introduce my colleagues, Dr. Callie Thomas from Johns Hopkins University and Dr. Emily Gadbois from Brown University to start their presentation.
Thank you, Angeliki, and thank you to the NACC for hosting us today. So we're delighted to share with you some research that we've been doing about Meals on Wheels raising awareness of the service and its benefits. So to provide some background and a backdrop of Meals on Wheels in the U.S., Meals on Wheels is a grassroots network that's made up of about 5,000 independently run community-based senior nutrition providers that are in essentially every community in America. And while these 5,000 programs vary in their size, structure, and services offered, they're all committed to supporting older adults to live healthier and more nourished lives in their own homes. The early history of Meals on Wheels in the U.S. dates back to 60 years ago when the first program opened in Philadelphia, Pennsylvania. In 1972, the U.S. government began supporting senior nutrition programs, but it's also known as Meals on Wheels, through the Older Americans Act, which makes up about 40% of programs' total funding for services. And in 1974, the first national meeting of Meals on Wheels providers was hosted in Washington, D.C. At the time, the program, or the national program, was called the National Organization for Home Delivered and Congregate Meal Programs, and after a few name changes is now Meals on Wheels America. So this is an infographic from Meals on Wheels America that shows that the solution really begins with the meal. So that's at the heart of the services that are provided, and that those meals meet national dietary standards. They're delivered through home or community dining, and they're offered regularly based on participants' needs. And through that delivery of the meal, there's so many more additional services that can be offered, including tailored nutrition, so medically tailored nutrition, social connection, which my colleague Emily Gadbois will talk more about during our presentation today, safety checks, identifying hazard, reporting on concerns, as well as resources and referrals. And ultimately, these programs result in improved health, independence, peace of mind, dignity, and respect for their clients. Next slide, please. The benefits of Meals on Wheels is presented in this slide. So this is it by the numbers. When the national, when a national survey is conducted of Meals on Wheels recipients, 100% of 100% of programs indicate that they provide socialization, and they train drivers on how to watch for well-being. They train them on how to look for safety issues. 44% of programs offer pet assistance, so not just feeding the older adult, but also their furry loved ones. And the cost of serving meals is less or about the same as a day in the hospital or 10 days in a nursing home. And that's the cost of serving meals for an entire year. And as you can see on the right-hand side of this slide, over 3/4 of participants say meals improve their health. 85% say they feel more secure, and almost 100% of participants say that the meals help them live independently in their homes. Next slide, please. And the research that we've done has supported these benefits. The first study that I just want to quickly tell you about was a pilot research study that we did with Meals on Wheels America called More Than a Meal. And we found in this study that, next slide, please, that when we compared individuals who were randomized, this was a pilot clinical trial, when they're randomized to receive meals compared to the group that remained on the waiting list, the control group, those that received meals had improvement in their feelings of loneliness, as well as their feelings of security and ability to remain at home. They also had a reduction in the rate of self-reported falls. Paired the kinds of meals that were delivered. So we randomized participants to get meals delivered once a week to getting meals 5 days a week. We saw that those who received the more frequent meal deliveries had improvements in their feelings of loneliness and safety and security, as well as a decrease in self-reported falls, suggesting that the kind of meal delivery has benefits up and above the meals alone, really speaking to the importance of this interaction, safety check, and socialization. We also conducted a retrospective claims-based analysis where we linked Meals on Wheels client data and administrative data with Medicare claims, which is the national healthcare payer for older adults. And we found that upon receiving meals, participants had reductions in their healthcare utilization. Next slide, please. So we saw that among participants in the 180 days before receiving meals, close to 1/3 had been in an acute care hospital, compared to 180 days after, only 1/4. Similarly, we saw that the rate of emergency department visits decreased after began receiving meals. Similarly, nursing home placement, we saw reductions in the 180 days after receiving meals. And when we look at having any of these events, a hospitalization, emergency department visit, or nursing home admission, almost half of participants prior to receiving Meals on Wheels had some kind of utilization event, compared to a little over 1/3 in the 6 months after. Next slide, please. We also found through our research that Meals on Wheels programs, in addition to these benefits that we're able to monitor and that we were able to demonstrate through our research, that these programs can monitor and report on changes in clients' conditions. So we conducted a process evaluation of a mobile application that many programs in the US use across the country, that essentially is a mobile routing application that tells drivers turn by turn where to go to deliver meals. And we added to that application a screen of whether or not there was a change in the client's condition. We worked with 2 programs. We rolled this out to 21 routes, 53 drivers, and 867 clients. And we trained these drivers to use this mobile app to submit wellness alerts. Next slide, please. And this is an overview of that change in conditioning monitoring and referral system. So as the driver delivered the meal on their app, they were prompted, was there a change in condition? The change that occurred, that referral was then, or that notification was then sent to a care coordinator embedded in these two programs, who then made a referral to one of these 11 different kinds of, referrals. Next slide, please. And what we found was that these two programs and the training these drivers generated 429 alerts for 189 clients, the most frequent being health related. And these 429 alerts resulted in 132 referrals to different kinds of social service agencies for self-care, healthcare management, and transportation.
I love this program. It makes me feel alive, like someone cares. And I know I'm not the only lonely senior. It made me feel like a person again. It made me feel wanted and loved and cared for. I did get lonely. I did get depressed, but no, they helped me through all that. And then this next quote, it gives me a little bit of comfort and reassurance that somebody knows I'm still existing. Next slide, please. And so then this next slide is quotes from volunteers and staff. It's my goal to go out and try to change somebody's life every single day. And in doing what we do here at Meals on Wheels, we're no longer just our Meals on Wheels. This is the best thing I've ever done, ever. I would never have known this incredible need is out there and that more people die from loneliness than almost any other disease. I mean, that's mind-blowing to me. I think sometimes people look at it, and I mentioned this in a team meeting, like, how could a phone call change somebody's life? It gives them hope, something to look forward to, just knowing that there's another human being on the planet that actually cares about them. And then this last quote, I was looking at one of our responses the other day, and the client said, so that's a little bit of what we've worked on previously. And I don't know if you want to jump in, Callie, but I just want to share, Callie is currently leading a clinical trial comparing the impact of different types of meals on client outcomes. And specifically in the US, Meals on Wheels programs are, there's this increased use of bulk delivered frozen meals as a lower cost alternative to the daily home delivered meals with the informal wellness check. And so programs are getting increased pressure like, oh, well, frozen meals are cheaper, maybe we should be using those. And so this trial, we're comparing the two different modes of meal delivery to hopefully be able to make some recommendations. And so that project is currently underway under Callie's excellent leadership, and we're really eager to share findings as they become available. All right, and just to sum up what we've shared, so as you all know from the work that you do, Meals on Wheels really is more than a meal. And programs that monitor changes in condition and formalize and standardize what many drivers were already doing, and then also programs to increase socialization are really just valuable opportunities to better the quality of life for clients. And so by addressing these issues, we hope we can lessen the risk of negative outcomes and adverse health events among older adults. And with that, I'll pass it on to Louise and Chris.
Hi there, everyone. Apologies for the slight delay there. We were having some technical difficulties in the background, which I think we've got resolved now. So all being well, this will continue seamlessly. Hi, I'm Louise Briggs, and I'm a team manager working for Bristol City Council. And one of my main responsibilities is oversight of the Bristol Meals on Wheels service, as we call it, community meals. And on the presentation with me today is Christopher Monaghan, and he's the community meals manager. So he's the operational manager working directly with the service. So thanks to the NACC and Angeliki for the invitation to contribute to the webinar today. I personally joined I'm on the previous slide still, great. I personally joined the service at the end of 2019. Have over 25 years experience in health and social care management, but at the time, much less in managing a catering operation. One of my first jobs at that point was to recruit a new operational manager for the service as well. So we both came as complete novices to providing a Meals on Wheels service. And little did we know that within a few months of joining the service, the COVID pandemic would be upon us. So that certainly added to our challenges, and it was a steep learning curve. Fortunately for us, the service was well established in Bristol with a long-standing and dedicated staff team, some having been with the service for well over 30 years. So, as I said, Chris is our current operations manager. He's been with the service for just a little under a year, and he'll be leading on the second half of the presentation today. Next slide, please. So we've had a meals service in Bristol for over 70 years. During that time, fundamentally, the goals of the service have remained consistent. We're helping people to stay independent, safe and well in their own homes. We deliver a hot, nutritious meal, a daily wellbeing check, and the really important thing, a friendly face at the doorstep. More recently with the service, we've got better at recognising our role in reducing social isolation and signposting onto other support services. We've recognised that we can add value by being an information sharing service for other community and voluntary support services, and we're really keen to build on that going forward. For that reason, when we were first approached back in 2020 by Angeliki from the University of Bristol, we're really pleased to start collaborating with her and contributing to the research project on the current role and impact on Meals on Wheels services in the UK, particularly in light of the pandemic. Next slide, please. So the meal service in Bristol is one of Bristol City Council's in-house services, so it's directly provided by Bristol City Council. During a review of our service last year, we were able to make closer links with our colleagues in public health. Unfortunately, they really recognise its role in public health improvement and preventing poor health in relation to malnutrition and social isolation. Where we sit in the council is within the wider Directorate of Adult Social Care, Adults and Communities, and the People Directorate. Previously with the service, there's been some history of it moving around directorates. I think at one time it was managed by our neighbourhoods and parks teams, so quite different. But we certainly think now that adult social care is the best fit. Being within that sector allows us to work closely with our locality social work colleagues, with our hospital discharge teams and our domiciliary reablement service. That in turn ensures that we've got established referral routes into the service and that citizens are made aware of the essential service at the point they are most in need of it. We are aware that not all of our neighbouring authorities in the West Country here in the UK have continued to directly provide a meals service. They therefore now have to signpost to maybe general meals delivery apps, voluntary lunch clubs, and a mixture of voluntary and community sector organisations. They might also offer frozen meal delivery and domiciliary care visits to bridge that gap from not providing a Meals on Wheels service. In Bristol, we certainly experienced our customer numbers dramatically increase during the pandemic, where we were delivering to about 260 customers pretty consistently. From the start of the pandemic, that quickly leapt up to around 320, 330 a day. And our experience certainly is that there continues to be a steady demand for the service in Bristol. Next slide, please. This slide just shows some stats there for you. It's a snapshot of our recent average monthly figures. As you can see, the only day off there we have one day off a year, and that's Christmas Day. But we do make sure that people are well catered for still on that day. For people that don't have family or friends that they're sharing the day with, we can provide a cold platter for the next day. We deliver those on Christmas Eve. They're really popular. We can also signpost on to other charitable organisations who do offer support directly on Christmas Day. So just to tell you a little bit about the policy and strategy in Bristol and Bristol City Council in regards to nutrition generally and access to food. So Bristol City Council and Feeding Bristol, an organisation called Feeding Bristol, have worked in partnership to oversee a food equality strategy. This is a plan for the next decade. It started last year, 2022, runs through to 2032. It's a publicly accessible document, so I've included a link in the slides, which I understand will be shared with you all following the webinar, so do take a look. It's a really great piece of work, actually. There were many stakeholders involved, including the University of Bristol, who contributed and helped to shape the plan. It provides a vision for food equality in Bristol and recognise that it's unacceptable that anyone in Bristol should face uncertainty about being able to access adequate food. On the right of the slide there, you can see outlined what we feel are the main ways in which our meals service works in line with the strategy. One of the key ones, I think, is those improved public health outcomes, which I mentioned earlier, improved nutrition for customers, often following a hospital discharge or a period of ill health. Having that access to nutritious meals is really beneficial for keeping people well, keeping them out of hospital and keeping them as independent as possible in their own homes. It also plays a key role, our service, in reducing that social isolation. The wellbeing check, it's an unobtrusive wellbeing check. People that are employed by our service, all our drivers, have an additional training called Every Contact Counts, and that's about recognising that when we come into contact with our customers, we can just have a quick check. Is their home warm enough for the time of year? Are they wearing the right clothing? Do they look like they've deteriorated in health? And then we can signpost on, and we can get safeguarding protocols in place if we need to. Next slide, please. Thank you. So this slide just shows some of the key aims from the strategy and policy in Bristol that I've been talking about. We think it's clear to see where our meal service contributes to these, in particular that residents are able to access food that's appropriate for their dietary needs, is culturally appropriate and affordable. We think that's our service's primary outcome and our primary focus. So just to conclude my part of the presentation before I hand over to my colleague Chris, I'd like to share a quote which is included in the strategy from our Deputy Mayor, Councillor Asher Craig. I just feel it really echoes the research by Angeliki and her team. Here's the quote. Oh, not quite. Sorry. That's it. Great, thank you. Food is essential to all our lives. Not only does it fuel and sustain us, it also plays a crucial role in the fabric of our city. It brings people together, is an expression of culture, binds communities, and drives a thriving and vibrant economy. In this way, food plays a central role in the health and well-being of us all as individuals and for our communities. And when we are not able to benefit from food in this way, food can become a significant cause and driver of inequality. On top of this, the economic and social impacts of COVID-19 have worsened these issues and left more people struggling to afford to access a nutritious diet. Nationally, the pandemic caused a sharp rise in the number of people seeking emergency food support. And I want to acknowledge a strong network of voluntary, community and grassroots organisations in Bristol that have done an incredible job meeting this need, in partnership with the council and many other organisations across the city. This has highlighted the need for us as a city to take urgent action, not only to ensure support is available to people when they need it, but also to take a committed and dedicated view to preventing these issues from arising in the first place. And that quote is exactly what we work in line with in the Bristol Community Meal Service. I'm just going to hand you over to Chris now, who's going to talk a little bit more about the operational service and what happens day to day.
Thank you, Louise. Next slide, please. Thank you. So as Louise said, we've been running the meal service in Bristol for over 70 years. And one of the key areas that we need to look at is how we change the people's perception about the meal service. We're looking at trying to move away from the notion that we provide an unappealing and bland meal with low nutritional value and limited choice. And we also want to highlight that the service is not just a doorstep service anymore, but we are actually doing more in terms of our welfare checks. We do have a limited time with the service user that we have. We only have 2 to 3 minutes per day. And during that time, the drivers do work with the people regularly, so they do build up a rapport. So when they have that 2 to 3 minutes, they're able to do a welfare check, so they can see whether the service user is disheveled, whether they seem confused, whether they're upset, whether they've eaten the meals from the previous day, and then we're able to feed that back to the appropriate next of kin or care support. But we're also looking at the building as well. So we're looking to see whether there's any trip hazards, to see whether there's any kind of, I suppose, currently at the moment with the weather getting colder, we're checking to see whether the boilers are working, etc. So then we can feed that back, so then we can have essential maintenance carried out on the property. I think it's important that we stay in regular contact with the service users. And one of the sad things that we do have nowadays is that we're seeing that we're having more falls at the home. And it was touched on before that Sadly, we could be the only people that would visit during that 24-hour period. So we do have people on the floor. All of our drivers are medically trained. So they do have first aid training, so they are able to support, and then they can feed back and wait until medical services are able to attend. Next slide, please. So as I said previously, we are looking at changing the perspective of the meal service and moving away from bland food. The cornerstone of our meal service is a frozen meal that we do heat up in the back of our specially adapted vans, but there's so much more that we do. We provide breakfast and tea meals now, and these are made fresh on site. So we can provide fresh soup or fresh sandwiches, jacket potatoes, fresh made salads or homemade cakes. And we think this is really good because we can receive input from the service users, and we feel that we listen to what the customers' needs are. We do pureed and textured foods, and we don't only just deliver to people at their homes, but we deliver to day centres, elderly people's homes, and also to reablement units. One of the areas that we are looking at expanding is the culturally appropriate food. At the moment, this is only a small part of our meals, unfortunately, because there's not the uptake, but it's something that we're working on. So we do provide Afro-Caribbean meals and halal meals. We also do hospital discharge packs. So if people have been in hospital for a long time and they don't have anything in their cupboards, so we're able to provide milk, bread, eggs, whatever they think they need. So they have the essentials at home when they go home. And we do a bread and milk delivery service as well. So if the service user contacts us before 10 in the morning, we're able to deliver bread and milk to them on that day. Next slide, please. So here's just a price list of our current prices for the current year. We're currently working under £6 for a hot meal and dessert delivered with a welfare check. This comes as part of a package of care. It has to be part of a package of care to have the reduction, 20% reduction, or not paying the VAT. And I think currently with the current climate of food prices going up, diesel going up and fuel, and also staff wages going up, we do have to be subsidised by Bristol City Council. And I think this is important to keep the service affordable to the vulnerable people that we support in our community. And I think if you add in a welfare check as well, delivering a hot meal and having a welfare check at lunchtime, in terms of a package of care, it reduces the need for more formal care that can be a lot more expensive. And here we just have a little list of some compliments that we received from the service users. I'm just going to read one out because I think this sums it up perfectly. I just want to say a huge thank you to every single one of you. I am registered blind and rather housebound. Your service has never failed me for the whole 3 years I've been using it. You must be under huge pressure, but you cooperate to make sure that my hot meal is delivered and a daily welfare check is carried out with kindness and competence. I could not do it without you, so take care of yourselves and God bless. And I think it's important to reflect on, well, the importance of the impacts that we have on our clients' lives. And I think this is only possible due to the dedication and the hard work of the staff team that we have. We have delivery drivers and they're out in the rain and the snow. It's been hailing and strong winds today and they've been out there delivering. Also in the heat, over 30 degrees, and they have an oven in the back of their van. I tell you, it's very, very hot in there, but they do it with a smile. They're dedicated and they're upbeat and positive, and I think that reflects in the service that we offer the clients. And I think that's the cornerstone of what makes the service so great. Here we have just a little demographic, a little pie chart to show you that we still are very predominantly delivering to white British people. As you can see, it's 80% of our clients at the moment. We do have a smaller group of Afro-Caribbean. And one of the things that I'm looking for me personally at the moment is how we can reach different culturally diverse groups. We have spoken to, say, for example, the Somali group and see how we could support them. But we have to take into account there are cultural differences. When speaking to different communities, they say that they tend to make food at home and they're often delivering meals to their neighbours or to vulnerable people in their communities already. So it reduces the need for formal input. But there are still people falling through the net, and it's how we can support those people. So as I said, speaking to the Somali community, they said that they wouldn't really need the traditional style of Meals on Wheels service where they're eating individually in their home. They see eating as a communal activity. So they asked how we could support them. So one of the areas that we're looking at is that we have kitchen space here that could be used. So potentially they could come in and they could make culturally appropriate food that then we could distribute throughout the community. And then, as I said, it's part of a communal activity then rather than eating isolated. And also we're looking at using the kitchen space for lessons. So we could have people coming in and they would be able to pass on their skills and their knowledge, teaching other people how to make culturally appropriate food and healthy food. So once again, helping people to help themselves, which I think is important. So here we just have a couple of ideas, as I said, talking about how we can link with different people in the future. So we're looking at community groups, we're looking at community gardens. Can we support people if they have allotment projects? Can they grow their own fruit and veg? And then can we support them to make meals to distribute to the community? Once again, reiterating the support of helping people to help themselves to reduce food inequality. We do have wellbeing projects, and we're looking at having strong links with charities. So Age UK, Dementia Wellbeing Service, and we have strong links with the Marmalade Trust, which is a loneliness charity that's trying to reduce socialization. We do have a newsletter that we deliver every 3 months because a lot of the people that we support don't have internet connection. So it's how do we get information across to them? So in these newsletters, we're touching on subjects such as assisted technology, so we can give links to people, so if they need fall alarms or pendant alarms or epilepsy monitors, then they'll have information about how to receive them. We have links with the fire brigade, so then we can have 3 smoke alarms put up, or we could have, say, key safes put outside people's houses to support with easy access. And I think also in terms of Bristol City Council, one thing for me personally is that we are a high quality, trusted service. And I think this is important because, as I said, it's a key motivator for me because we have Bristol City Council's reputation to uphold, and it's important that we strive to deliver an excellent service to our customers. And here we just have a little bit of contact information. Personally, for me, I think it'd be really important that there are other people from different community meal services. I'd really like to get hold of you. We can share ideas because ultimately we are working towards the same goal. We are working to try and make all of our services better, with the ultimate goal that we're trying to support people to be happy and healthy and ultimately well fed in their own homes.
Thank you. So an important component of the Meals on Wheels week is raising awareness of this crucial service that helps adults with care and support needs live independently and well in their homes and communities. And today, I'm really excited to present to you the resources that we developed at the University of Bristol, working together with people with lived experience of Meals on Wheels under the wider Meals on Wheels research that I lead in the School for Policy Studies to raise awareness of this important service, but also forgotten service. Next, please. And I say forgotten service because not many people know that Meals on Wheels still exist in this country or what form they operate under. It doesn't help that there is no universal definition of the service, and there is also no universal name for the service in the UK. A recent review that we conducted identified different names of Meals on Wheels services, including community meals, community kitchen, meal services, home delivered meals, to name a few. Also, because receiving Meals on Wheels is not a statutory entitlement, we all know that, it is challenging to establish who takes responsibility for a nutritious meal for adults with care and support needs. So these individuals might not know who to contact or where to look in order to access a meal. Next, please, Tash. So why is raising awareness important? More than 15 million adults in England alone live with care and support needs due to a long-term condition or a disability. And many of these individuals cannot leave their home and might not be able to acquire the ingredients and prepare their own meals. Traditionally, Meals on Wheels have been provided by local authorities, but we all know that in recent decades, due to budget cuts, more and more local authorities have been closing the services. And if you attended the webinar on Monday, you must have heard the concerning number from the APSI report that currently only 29% of local authorities in the UK are providing the service. Now, even though many third-party providers like charities, the private sector, social enterprises have filled the gap where local authorities do not provide the service anymore, and they are doing a fantastic job at it. Not all local authorities signpost to these providers, and there is often no single location for someone to find where or if Meals on Wheels are provided in their area. Next, please, Tash. And our study of service providers in Southwest England suggested that lack of awareness of services does exist. One of the drivers who delivered the meals said, I, like a lot of people, didn't realize this service still existed. And I didn't also realize that part of the service was to offer a bit of support. So the issue of awareness can be twofold. One, lack of awareness that the service exists, and two, lack of awareness of what the service actually provides. Next. And this lack of awareness was corroborated by interviews that we conducted with users of Meals on Wheels services and people who refer a family member to Meals on Wheels from 4 different providers across England, with some participants vaguely being aware of the service, while others considering it to be a well-known concept, even if it's not called Meals on Wheels anymore. For those participants who knew about the service, some were aware of the service via word of mouth and the media, while others through previous involvement of family members who had either been working for the service in the past or had been recipients of the service. Next, please. Despite historical knowledge of the service, however, one participant highlighted that any knowledge about Meals on Wheels does not actually register until one actually needs the service and inquires about it. So again, we see that some people who could benefit from Meals on Wheels might have heard of the service a bit or know vaguely of it, while even those who have heard about the service might not know all the wider benefits that the service provides. Next, please. And on top of issues of lack of awareness of the service and what it provides, we found that there are certain preconceptions surrounding the use of Meals on Wheels that might hinder uptake. These were that Meals on Wheels might remind people of school meals, despite our participants saying that absolutely commending the quality of the meals. And the other preconception is that Meals on Wheels are for older people only. And I love this quote from a family member. She was very resistant to it, very resistant, because Meals on Wheels are for old people. She's 88, bless her. So Meals on Wheels providers could address these preconceptions around age by raising awareness that Meals on Wheels is for any individual who cannot prepare their own meals, irrespective of age. And because it has been suggested that the public might be reluctant to access services if they consider their quality to be low, Meals on Wheels providers could consider addressing the school meal preconception by highlighting the tastiness and quality of the meals on offer. Next, please. And of course, when we're talking about raising awareness, we also need to consider who makes the Meals on Wheels referral and who actually sets up the service for an adult with care and support needs. Our research identified different routes of referral, of signposting and referral to Meals on Wheels services, including through needs assessments from social care professionals and workers, domiciliary care workers, and often it was these professionals who set up Meals on Wheels for users of the service. Sometimes, however, support workers signposted family members of an adult with care and support needs to Meals on Wheels, and it was the family member who made the actual referral. In fact, many of our participants who referred a family member to Meals on Wheels highlighted that they were the ones who inquired about and set up Meals on Wheels for their loved one by conducting internet searches and calling the service provider that they had identified online directly. None of our participants mentioned direct referrals from general practitioners or hospitals. So awareness raising activities should also address healthcare professionals. And we believe that if awareness activities address carers, healthcare, social work professionals, referrals to the service will increase so that every adult with health and support needs could benefit from the service. Next, please. And of course, when we're talking about raising awareness, we need to raise awareness of the wider benefits of Meals on Wheels. And the most important benefits that our research has identified is the access to a daily nutrition meal, the reduction in social isolation, the offer of well-being checks, and the promotion of independence. And these four were the most important benefits as ranked by a group of people with lived experience of Meals on Wheels who act as the advisory group for our research. And it was this group who asked us, when we develop resources to raise awareness of Meals on Wheels, that we should also highlight the consistency and reliability of the service, in that services delivered through adverse circumstances and through come rain, come shine, come pandemic, they never failed me, and they will, people will get that meal. Next, please. So to sum up, our research has highlighted the need to raise awareness of Meals on Wheels, awareness that the service exists, awareness of the most important benefits, and that Meals on Wheels is more than just a meal, awareness among different groups of people who could refer someone to Meals on Wheels, and also the need to address preconceptions that surround Meals on Wheels use. So we conducted 4 participatory workshops with our advisory group, who all have lived experience of Meals on Wheels, with the aim to translate our research findings into resources that could help practice and policy. We co-produced 2 infographics and a film to raise awareness of Meals on Wheels. And I would like to highlight here that the messages in these resources, the images that were used and how the messages were framed, are the result of co-production, making them directly relevant to the real world. Next, please. So the first infographic that we produced, Meals on Wheels, Is This For You?, has been designed taking in mind a potential user of Meals on Wheels and the person who wants to support someone with care and support needs to access a meal. It points to how Meals on Wheels can help these individuals and where more information can be found about Meals on Wheels. And when you have time to look at the images, you will look that we try to make them as inclusive as possible to also address, for example, the age preconception. This infographic can be used by service providers for their publicity, awareness-raising materials, so that they help people who are interested to find out about the service to make an informed decision. And it can also be used by general practitioners, health and social care teams to help with referral decisions. Next. The significance of Meals on Wheels infographic highlights the wider benefits of the Meals on Wheels service to users of the service and their family members. And this infographic can be used again by service providers, either to raise awareness of the service to the public, but also when they undergo reviews so that they continue funding the services. And it can also be used by commissioners and policymakers to inform the future of Meals on Wheels services in the UK. Next, please. We also developed a film presented in a long version of 7 minutes and a shorter version of 2 minutes that outlines the wider benefits of the service and features interviews with a user of Meals on Wheels, a family member of someone who uses Meals on Wheels, and the amazing Bristol Community Meals team. And these films can be used again by Meals on Wheels providers to raise wider awareness of the benefits of the service. Next. Finally, we have produced a policy briefing that presents key findings and policy recommendations from our research. And again, this can be used as an evidence-based resource to help decisions around Meals on Wheels fundings and running. Next. Just to highlight that these resources can be used individually or alongside each other as you see fit to help raise awareness of services. Next. And I guess the most important question that you might have, where you can access these resources. We have developed a platform at the University of Bristol website, and I'm providing the link here. I will also email this link to all the contacts that I have in the Meals on Wheels world. And in this website, you can find both infographics, the short version of the film, and the policy briefing. I would like to highlight that the resources are completely free to download and reuse. You just need to review a few license terms and answer a few questions. Please don't be put off by that. It's a standard template that the University of Bristol uses, but they are free to download and reuse. Next. And because the long version of the film did not fit the previous platform that I showed, I have also put together a short blog that links to the long version of the film and puts together all these resources. And the link to that you can see on the screen. Next. So this is the end of my presentation, with a huge thanks to our advisory group and my colleagues at the School for Policy Studies, who I think most of them are here right now, who have supported this research. I do hope you find these resources helpful to raise awareness of this important service. Next, please, Tash. And just finally, I have my contact details available. Please do contact me to discuss these resources. We do value your feedback, and we want your feedback to make this better. Thank you very much. So I think we have a few minutes left, so I'll step into the Q&A. Oh, I think 70 questions have already been answered. Thank you so much. We have a question from Stephen about, I think, the Bristol Community Meals team, whether you have landed a break-even price for this service, and do other partners, including Health, fund any of this service?
I can jump in on that one, Angeliki. Unfortunately not yet, but we are working on it. We're currently actually working with a consultancy firm around looking at heading towards that break even. So we're not a million miles away, so we hope that we will be able to get there, and that'll even more so reinforce our position with Bristol Council continuing to have an in-house meals service. We don't currently get any additional funding from the NHS. We have had some short-term grants in the past, often around winter pressures, so and enabling hospital discharge. We've had small amounts of money to support that, but we don't get any long-term funding from the NHS. Great idea, though.
Thank you, Louise. Yes, I think the chat is getting too long now, so I think yes, thank you all for your support and being here. Neil, I'm not sure if you'd like to jump in as well with any background questions or anything that we might have missed.
Hi, everyone. Yeah, just for myself, I just really want to say thank you to you all for giving us such an informative presentation today. The chat has been really busy with a lot of questions. And thank you for answering a lot of those questions directly to some of the people who have been asking the questions. But yeah, no, I just wanted to say a huge thank you to you all for coming along today. Thank you also to all the participants who've registered to attend today's presentation. I just wanted to say a bit of an apology from our side. There was a little bit of an interruption at the beginning of the webinar. For those of you who are clicking in from outside the UK, we have got Storm Kieran making its way inland at the moment, and unfortunately, it's somewhere near Sussex at the moment, and there's quite a lot of high winds in that area. We will be sharing today's video, the infographics, the slides to you. We plan to send them to you probably by the end of the week or early next week. So please keep an eye out for them in your inbox, and we will get that all sent to you so you have those copies, including the link to the infographics as well that Angeliki has spoken to you about. So you won't miss out on that at all. As an association, we are planning to, even though Meals on Wheels Week is just for 1 week a year, with the concerns that have been raised from the report and the challenges we're facing around funding and statutory requirement and so forth, we will be continuing on the journey to raise the awareness and raise the profile for Meals on Wheels. So if you would like to join us on that journey, if you're on this particular webinar, and you are not a member of the NACC, when we send out the email, if you just drop a note to us to say you'd like to stay in touch with us, we'll make sure that you're kept involved as well in what we're doing and how you can get involved with raising the profile from what you're doing in your own services in your local areas. So thank you again for joining us. Enjoy the rest of Meals on Wheels Week. And if you are celebrating the week this week, don't forget Friday's initiative, which is Friday Friends, which is all around raising the awareness around lunch clubs and day centres and the value of having a meal and using that opportunity to reduce loneliness and social isolation within our communities. So I look forward to seeing all your pictures, and thank you very much again. Thank you.